Hi, thanks for joining us. I'm Jennifer Robinson with Spherix Global Insights. For those of you who do not know Spherix, we are an independent business intelligence firm that focuses on tracking market trends in 5 key specialties: gastroenterology, rheumatology, dermatology, nephrology, and neurology. And we offer syndicated market research that really helps our clients make better business decisions through our unbiased collection of data. And I'm here today with Scott Fraser from Fraser Healthcare. Scott.
Thanks, Jennifer. It's really been a pleasure partnering with you and the team at Spherix Global Insights on this important project. By way of introduction, Fraser Healthcare is a healthcare strategy firm that partners with leading private equity firms for MSO transactions. I'm also a board member of a newly formed MSO called Pinnacle GI Partners, as well as consult with Fortune 500 clients on crafting commercial strategies and structure for consolidation in the healthcare delivery models.
Great. So Scott and I have known each other personally for a number of years, and we happen to be discussing one of Spherix's reports on the impact of COVID-19 on specialty physician practices. And I was sharing with Scott that we really saw gastroenterology practices in particular take a big financial hit, largely because they lost the opportunity for elective procedures. And this led into kind of further discussion about, how did we see these practices dealing with this financial impact, and that in turn led to a discussion about consolidation and the increasing activity with management services organizations. And Scott's going to talk a little bit more about what he's seen from his angle.
Indeed, the COVID pandemic has exposed the vulnerability of all elective procedure-based subspecialists, and GI was definitely no exception. Fortunately, gastroenterology has rebounded, and diversified groups with strong ancillary clinical lines like infusion have recovered much faster than those groups that solely rely on their office practice and procedural income. On the topic trend of MSOs, which are newly created entities with a financial sponsor or private equity firm, a platform GI group, the founding group, sells off a portion of the practice EBITDA or profits for an agreed upon multiple to a private equity firm. Post-transaction, the back office of a group is carved out to create an MSO or a management service organization. That MSO is invested in and is co-owned by the physician partners and private equity firm, and scales to not only support the initial practice, but to support many, many more practices. And to date, we've seen 7 MSOs form in the last 4 years in the gastroenterology space, and close to 1,000 physicians have now joined these MSOs. It is changing this market dramatically. And you think about what the pandemic has meant for these MSOs. They have really flexed their muscle during this pandemic because these groups have a financial sponsor. But more importantly, these groups have resources. They have resources to attorneys, to accountants, and a playbook for furloughing staff and doing it in a way and doing it quickly, and then bringing staff back as elective procedures were opened up again. These MSOs have also really provided a resource with sourcing. And in this scarcity time with PPE, as well as some of the critical drugs related to gastroenterology, that being propofol for sedation, the MSOs have been able to actively stay on top of this. Because these MSOs have dedicated administrative executives which are focusing on running the back office, allowing physician partners to focus on clinical care. And no time more than ever has this been more critical than during this COVID pandemic. If you think about the added time and effort each caregiver has to take to work in a COVID environment to deliver care, it's reassuring to these MSO members to have a competent back office and not to be worried with running their practice. And our comprehensive research has really identified this growing trend and interest from the fiercely independent field of gastroenterology to now be interested in joining MSOs for security and supporting them during this turbulent time. And we look forward to sharing this with you.
Yeah. So Scott and I, in this discussion, decided that there was a really good opportunity to take our blended perspectives and really go deeper to evaluate how this trend is likely to impact companies who have assets in the IBD space. And we went through a survey of more than 130 MSO and non-MSO affiliated gastroenterologists. We conducted countless interviews with executive management at some of these MSOs and also physicians who had recently gone through such a transaction. And at the end of the day, we're looking at what are the impacts going to be at 2 years, at 5 years, and at 10 years, and how are pharmaceutical companies going to need to morph in order to remain partners to this growing and very unique physician segment. So we're very much looking forward to kicking the project off. It's called the Business of Gastroenterology, and the results will be released next week.
Thanks, Jennifer. Yeah, over the last 2 decades, we have all witnessed massive consolidation in the healthcare ecosystem. And if you think about the insurance companies, the hospital networks, big pharma, biotech, medical device, we've seen a flurry, a wave of mergers and acquisitions, and ultimately consolidation. And we're really at the forefront of the consolidation within subspecialty medicine. And gastroenterology is following a proven pathway that private equity has done through their power and their resources and what's considered dry powder, which are the trillions of dollars that private equity has from investors to invest in privately run businesses. And it's amazing to witness the pace of this MSO consolidation. And I encourage our clients to stay ahead of this trend, as it will definitely reshape your customer base and the requirements from you as a partner.
Great. Thanks again for joining us, and we look forward to talking with you soon.
Thanks.